hand the mic over to Dr. Michele Barry, who will be introducing the alumni panel, Women in Science.
Hello, everybody. As Joe said, I'm Michele Barry, and it's always hard to follow Tony Fauci, but I think this will be an exciting panel on women in science and research. Before we get started on this panel, I'd like to actually share a few facts about women working in the field of global health. And I'm hoping that this comes up. Joe, can you see this?
We can, yep, perfect.
So as some of you may know, I'm very interested in women leadership in global health, and how did this start? It's been a long life interest, but it really came to a head at a MEPI meeting in 2016 with all the deans of all the African medical schools. And as you can see, they were all male. I mean, you can see Roger Glass, Wafa, myself in the background, but the people that were presenting were all male. So why did this become important? It's not advancing. That was 2016. And as you can see, it hasn't really changed. In 2021, this was an all-male panel of science and health experts, what we call a MANL these days, to advise the G7 summits on things like pandemics and global health. You know, so women are not in leadership, but women are pretty much all over global health. They represent 70% in the health and social sector, yet they're not really in the leadership positions. Look at the fourth line. You can see that we're 50-50 in medical students and have been for some time. Yet CEOs of healthcare insurance and providers, huge disparity. There are only about 16% of deans in US medical schools that are female. But when you get down to, and all the CEOs of global health education, which I think it's a great, if anybody's interested, you should pull the 50-50 report that Sarah Hawkes and Kent Buse did to show that we in global health organizations don't do such a good job, that only 25% of folks are women in global health. Yet, if you look at who's doing global health, the healthcare workers and social sectors, they're predominantly women. So we ran a few conferences to try to figure out what some of these challenges were, what some of the obstacles in climbing into a leadership position. And one were the institutional ladder, and I'll go into that a little bit, tensions between career and families. And the third was health and safety issues. With challenges climbing up the institutional ladder, gender bias and discrimination at work was in resource-poor countries quite overt. In resource-rich countries, people call it subconscious bias. I call it covert bias, but that's kind of what a challenge you have to get over. And then there's this concept for some of us that are older of being put in a leadership position on a glass cliff. You break through the ceiling, but then you're put on a glass cliff where you're given a leadership position, but you fall off because you're not given the resources or the backup or the infrastructure to make you successful. When we think about tensions between career and families, one has this career that's happening during our reproductive years. And that's the time when we need to spend time abroad. And even if we have children, it's often difficult to get that time abroad. And then we become the sandwiched generation where we're taking care of elderly parents as well as young children. And the third area is health and safety issues. The risk of sexual violence. 2/3 of women have experienced gender harassment, and 1/4, and I've had friends that have actually been raped in the field. So 1/4 experienced sexual assault. So this panel is to try to convince people that there should be more women in global health leaderships to reduce the worldwide inequities and disparities. And I have the pleasure now of introducing 3 of my panelists who will talk to you a little bit about some of the barriers and some of what they think the future should be. The first one is Ana Lucia Rodriguez de la Rosa, and she was a global health equity scholar predoctoral in Colombia between 2018 and 19. April Evans, who was a UJMT Postdoctoral Fellow in Malawi, and Ernesha Mazinyo, who is a GloCal Postdoctoral Fellow in South Africa. Now, I was going to introduce them and give you all their credentials, but when I had a pre-meeting panel, I realized I cannot do justice to what they're doing and who they are. So I'm going to ask them to introduce themselves. So Ana, and I guess what I want to do now is escape my screen. Yes, great. Ana, you want to introduce yourself?
Of course. Thank you, Dr. Barry. It is an honor to be here. Well, as you said, I served as a GHES Predoctoral Fellow in 2018 in Colombia. I lived and conducted research in an Afro-Colombian rural community for a year. And while I was doing my GHES life-changing fellowship, I worked with 242 adolescents and their families to study social networks, gender violence, and how they experienced violence in their families, in their communities. With this work, I got to earn an award with the provost of my university for community engagement. But I think most importantly, I got the opportunity to engage really in a life-changing experience of what it is to go into the field. I have received funding from the Complex Systems Society, from the American Psychological Association, and I continue to do research in social network targeting algorithms in order to magnify population level changes. So I am currently a postdoctoral fellow at Yale University in the Human Nature Lab. And as an immigrant, I was born and raised in the Caribbean region of Colombia. And I am so excited about this panel because for that same reason, I co-founded something called Asociación de Mujeres Caribeñas en la Ciencia, which is a unique situation because the fact of being a woman in science in this setting where I grew up is challenging already the cultural and gender norms. So I'm very excited to be here because I'm very passionate about this topic, and hearing my other panelists and being with Dr. Barry will be, I'm sure, a very interesting conversation about what we go through as women in science.
Thank you, Ana Lucia. April, do you want to introduce yourself? April.
Yes. Sorry, guys, I lost connectivity on my computer. And I usually said that when I was in Malawi. I haven't said that while in the United States. So definitely a new excuse for me. So just briefly, before I introduce myself as like who I am now, what I'm doing, I just wanted a quick kind of reflection on where I came from, because I think it'll provide a bit of insight on how I came up with the project and things I'm passionate about now. And so I grew up, as you can tell with the accent, in a really rural community in Southeast Texas called Tarkington Prairie. And I feel like anything with prairie attached to it gets the designation of rural. And then even, I mean, now looking back, I know that my family income was well below poverty line, but growing up, I didn't know that. And I remember being that type of family who only went to the doctor if you were absolutely dying or the bleeding didn't stop for 24 full hours. And I joke, but it just kind of provides, like, as a child, that sets like your mindset of what, when you go to the doctor, why do you go to the doctor, and things like that. And I remember asking my mom and saying, Mom, why don't we go to the doctor, more often? And she would always mention something that revolved around money or access to care. So even as a kid, I thought, that's really not cool. And I told my mom, and she says at the age of 6 that people deserve to see a doctor, and a good one, and I'm going to do something to fix it. So she always joked and said, well, you better get started. So here we are, I hate to say 20 years later, but 20 years later. And my projects focus on providing care and giving people a voice in underserved areas all over the world. So I am a UJMT Fogarty Global Health alumni and a third-year Pediatric Hematology-Oncology Fellow at the University of North Carolina. My goal for my project is to make patient-reported outcomes the global gold standard to assess health-related quality of life in children and adolescents diagnosed with cancer in sub-Saharan Africa, ultimately reducing symptom mortality and burden. And so I worked with Dr. Kate Westmoreland at the UNC Cancer Program in the Lilongwe, Malawi for the last year. And I also worked with a world-renowned psychometrician, Dr. Reeve. And the project that I did during my Fogarty allowed the implementation of cutting-edge pro measures in Malawi. And we feel ultimately harnessed the voice of vulnerable and silenced patients across the globe.
Thank you.
Yeah.
April, would you like to introduce yourself? I'm sorry, Ernesha. April, you did a great job introducing yourself. Ernesha.
Hi, again, I think I echo probably the gratitude just for the opportunity to be on this panel with one of my heroes, Professor Barry. She probably doesn't know that, but I've been following your work for a while. And when I think about how I want to introduce myself, it really is about the journey to here. And it's interestingly enough, in the previous panel, Dr. Fauci said, oh, if your parents want you to do something, or if it's an external interest, then maybe that's not going to make you happy. And I thought the irony is I am a scientist because my mother could not be one. She saw a microscope for the first time, maybe her sophomore, junior year in college, and she was drawing her eyelashes because she didn't know what it was. And she was so embarrassed by that, that she told the story to me as, I was growing up about, the importance of science and, women can be scientists too. And that was, just one generation ago, considering it's my mom. And I think she took deliberate action, along with a number of deliberate actions, I think in that late 80s, 90s, where, there was this encouragement about girls and introducing them to science. And I believe I'm a result of those deliberate actions. And I am I'm amazed at what has happened from sort of walking this career as, and starting out sort of as a chemist, and sort of pivoting into public health, but also in global health. And I sort of came to South Africa on a 6-month leave of absence from the Department of Health, and it's 15 years later. And I'm here leading. I used to lead a large public health response to TB and HIV. And from leading those really great successes, but also failures, it really had sort of shaped, I think, my interest now and the interest that I was able to pursue through the GloCal Fellowship and really through the Office of Research on Women's Health that was able to support my work looking at STI testing, point-of-care testing for women in pregnancy, but also supporting this work around adolescents and girls, young women, and their access to mental health treatment. So I think that's a brief overview of me. Thanks.
Thank you, Ernesha. So let's get down to some of these questions. So I'm going to start with the first one. How have you navigated a system that can still be very patriarchal? What challenges have you experienced as a result of this, and how have you overcome it? Who would like to be the first taker of that?
I can go. I would say that to call the patriarchal system means that we have to think about that this is a complex and multi-layered situation. This is a one-on-one conversation with your mentor, but this is also a cultural situation that varies depending on the context that you're in. I discussed this when we were preparing the panel, and I said that there was a woman scientist in my country of destination with a lot of prestige, which ironically was the person that would constantly mansplain me where I was. And then now I have another mentor who is actually a man ally that would allow me to flourish and mentor me on a personal level. I also had wonderful mentors that were women. So I would say what we're really targeting when we're discussing this is the idea that we do not fit the model or the pictures, as Dr. Fauci already mentioned 5 minutes before this panel started. So even when we might be violating our stereotype or the stereotype, we also bring that to our countries of destination. And we also have to sort of like think about what are the norms and the gender norms in those countries of destination, and how we unpack in ourselves those ideas that have been grounded, at least in my case. I did not want it to be the problematic person having that conversation. So for a long time, that naiveness of sort of like either denying and not being capable of being outspoken or even saying out loud that I was a woman with a disability, for example, was something that I was thinking that was for people already established, already like up in the career path. And then when I was in the field, I saw one of my mentees, one of my RAs, say out loud to this person that was sort of like mansplaining the situation. She stood up and she said, "This is not okay." And she bravely and very assertively addressed the issue. So at that point, I said, well, maybe I am bringing with me and in me some of this cultural, gendered bias that are all over the place in the establishment. So I would say it's not about how do you identify, it's how much and with whom you share that path, and how that is intervened in complex and multiple levels. And I know that some of the other questions will dig into this, so I'm going to stop there to give space to the rest of the panelists to tell some of their stories.
Thank you, Ana Lucia. Ernesha or April, do you want to take this question?
I can.
Either of you.
Yeah, for sure. We both really like to talk and we're excited. So I was trying to give her a moment. So we talked quite a bit about this. So as I said, my site was in Lilongwe, Malawi, which is in Eastern Africa. Prior to going there, I think the longest I had spent overseas was 4 months total. And that was in Tanzania. And I'd previously been to Kenya. But when going, I was so excited. And I was like, I just felt like I could conquer the world. And I had all of these ideas. And I think I was, one, I've done it, but two, I was a bit naive in thinking that that I knew a lot going into a site and what it took to be successful and to implement my study, right? So I thought, gosh, I've been to 22 countries, I got this. So I show up in Malawi and excited, and then I realized over a year that, you know, life is different living somewhere for a year than it is living somewhere for 6 weeks or living somewhere for 8 weeks, or doing your rotation and the reward and going home. I realized at first that I didn't truly understand how their system worked. I didn't truly understand that, you know, I was seen as a woman. I didn't understand that was an issue. And so at first, my stubbornness was like, well, I'm just going to break this mold and we're going to get this done. And I realized that it was met with some adversity. And I think it didn't come off how I wanted it to. And so a couple of weeks in, I thought, gosh, I'm really just not getting anywhere. So I'm just going to sit back for a minute, observe, see how things go, and go from there. And I realized that anytime I said something, for example, they would always look at my male counterpart. Like, did he agree? And we'll get to this later in the panel, so I won't touch on it now, but those people play an instrumental role in your success. And so I realized, oh, okay, this is what I have to do, and this is how things are done. And so what I did was work my way into their system. I built a trust. I showed them things that I knew how to do. My male counterpart said, oh, I agree with April. So his help was really, I mean, was amazing. But there's definitely things that you come across and they're real. And it's not about breaking that mold or barrier, really. It's about finding out how to integrate into the system, how to work around those cultural differences, and then use them to maximize your work there, and then the women that come after you. So I think like I said, I went in excited and thought I was cultured, as I call it, in the country, but I really didn't know. And so I think that this will be, even if you have previous experience overseas, I think that the year, it took me a whole year to truly understand my environment and to understand the culture truly. And I feel that looking back in other places I visited, I wasn't able to do that. And I think that I wasn't able to live up to my full potential in those areas like I was here in Malawi. And if you do it right, you know, they'll welcome you back with open arms. And I'm really excited to go back to the site one day.
I think April makes such an important point about coming into a site and not thinking you know everything about it, and stepping back a little bit for people to accept you and showing that you do know a great deal that's evidence-based, and really approaching it that way rather than head on. This is the way to do it. Ernesha, do you want to say a few words about your experiences of this a patriarchal system in science?
Thank you. I feel like April really said it nicely in terms of coming in for me with a cultural humility, like understanding that I don't know everything and I'm learning something here. And so it's interesting over time. The trust has been gained. There is an understanding. I also respect the cultural norms here. I realized very early on that I was not here to like upset the apple cart, as they say. I'm not here to say, this is not the way to do it, but I'm here to partner and to listen and to walk alongside. And so for me, it has really been interesting in terms of how I do navigate the space, which, I mean, I'm in South Africa, is very patriarchal. Essentially, I think the answer for me has been to form very strong allies with other men, but also there's what I call there's like a dance of respect that you sort of enter into, and it's worked. And so I think the reason why I've been able to stay so long and really put roots here is alongside this understanding of you can change a person by befriending them and walking with them than to be in terms of an attacking situation. So that's what I would add to that. Thanks.
Thanks. So that brings me to the question is, how have your personal experience as a woman changed or directed your approach to science? Or do you think that there is no difference?
Now that I'll jump in on.
Oh, go ahead, Anisha.
That one.
Go ahead.
And I say that because what I recognize is that I was watching people become experts on my lived experience, right? And so when you recognize that there's a problem, and what we are as scientists, we are committed to the world of ideas. We're trying to find solutions. We want to make things better. I knew that I had to be that person. There was the strongest sort of pull, but it was also, I'm witnessing development of programs or even research situations where it didn't really take into full understanding the needs, the wants, the situations of women. And for me, I knew then that is where I enter, and that a large focus of my work is on girls and young women, because I do feel like they are the future, but also they are the most vulnerable often in these situations, especially as the patriarchy reigns. And so I'll turn it over to my co-panelists, but that's my experience. Thanks.
Go to it, co-panelists.
I first met a woman with a PhD when I was 20, and I was already graduating from college. That says a lot. And I immediately knew I wanted to be an academic, a scientist, and I wanted to work in global health in understudied populations. How did I know that at the age of 20? I don't know, but I have been working with this population since I was a little girl. But it wasn't until I was really on the field that it really hit me that being a woman in science, collecting data in a remote setting that was only accessible either by boat or by a motorcycle made a huge difference. I needed to be escorted by men in the community, and I needed to make a huge allyship. And we're not talking about the piece of science. We're talking about in the community and in the field, and how your phenotype or the way you are seen by your own community of research or the people that you're trying to serve is also really important. I was very lucky because I think that there's a very particular thing about this fellowship, and is if you live there for a year, there's a lot of opportunity to build those relationships. But at the same time, I understood I couldn't walk alone. I couldn't do a lot of the things. I couldn't go into some places. I couldn't ask certain questions. My research project, which was partly focused on gender-based violence too, was focusing on adolescent girls and violence. So there was a lot of questions around that. And if we think about this happening in a rural community of 1,000 families, you become somehow somebody that everybody knows. But at the same time, this is informing your ability to perform research. So I had to learn sort of how to navigate that, understand how to protect myself. I think security is a huge issue. It has already been mentioned by Dr. Barry, and naiveness was a bad counselor in my case at the beginning. And I started experiencing a lot of the issues that other women have experienced, and Dr. Barry mentioned, and helping myself with building kind and I wouldn't say only cultural, but intellectual humility. I also tried, my project was community engaged, which meant I also let part of the research choices be made by them so that they could also answer their own questions. And that's another huge opportunity that you have here, that this being a mentored training allows you to do that. And one of the things that we discussed earlier in the panel was, would this have happened to a male identifying researcher? I really don't know, but what I do know is that these men that were with me in the community taking good care of me and sort of like getting me, allowing me to do this work. And this also women that were taking care of me in the community, can they be part of the budget? Can we think about that as something that women need in a differential way than men? I am used to, for instance, to exercise. There were things that I had to take into account. Yes, being a woman definitely not only informs my research agenda nowadays. I do work right now in maternal health interventions, intimate partner violence, and gender-based violence in Honduras, but also the way I understood my role as a researcher and how that is different depending on the setting that you are in and the needs that you have. So we're going to talk about solutions later, but I'm going to leave it there, not to take much time and space.
April, do you have a few words to say about it? If not, I can go to Claire. I have an interesting question.
I do. I work on patient-reported outcomes. Most people have no idea what that means, but it's to give a voice to people that haven't been heard. So as I mentioned before, I grew up in the South, so Southeast Texas, and it's actually a very patriarchal system still there. The man is the head of the household. His plate is made first. All the decisions go to him. So ironically, being put in a situation like that made me reflect on my own childhood. And I thought about it and thought, this absolutely affects my research. Like, I have felt that I wasn't heard. I have felt that I didn't have a voice in what I thought and felt didn't matter. And so I think it's hard to imagine that if you've never felt that. And I've talked to plenty of men about this in the past, and they're like, oh, I never really thought about it, or it's a different mindset. And my goal about being a woman in research is I don't want to be the same as a man, right? Because I'm not. And I have all of these unique experiences and goals and this different intuition. Like, I have so much to offer and I'm excited about it. And so being a woman is I think doing my patient reported outcome work, it's just like it's a benefit, right? Like, take all those trials and tribulations and things I've gone through and empower other women and let them be heard. And I'm excited about it. And also being a woman, like, I have a child. And so my work focuses on children being heard as well. And so, you know, I thought I was a great pediatrician before I had children, and I gave all this great advice. And then I had a child and realized, wow, I really tried hard. But now I have a unique perspective, and it's not just for me that I'm doing work for. And yes, I have a son, but I want to empower him and make him say, hey, you know, women have a unique perspective. Women have things to offer that you need to hear. And it's different, and it's okay that it's different. And I'm excited. I'm excited to be here and to offer that women's thought process and the experience in my field.
Thank you, ladies. My next question actually has been asked in the chat. I was going to ask a question about mentorship and how male allyship plays a role, but I'm going to ask Stephen Amoa, who actually raised this question, to unmute himself and show himself. I know it's unusual to take questions in the middle of the panel, but I like to have the interactiveness. So Stephen, can you pose your question about male allyship?
Right, so thanks a lot. I'm naturally interested in these issues because, well, I'm from Ghana and I was recently just trained in the US, and I had my PhD and also a postdoc in Johns Hopkins. And it was really exciting for my cohort that we even had more females than males in our PhD program. And I must say that that wouldn't be very common here in Ghana. I'm teaching in a medical school. Surprisingly, with the medical students, sometimes you have 50-50 ratio for both males and females. But for the postgraduate level, then we notice that there is usually a reduction. And I have observed, I've heard comments like from some of the older faculties, when women are raising families in their programs, sometimes they seem not to encourage that. Some things that if you are raising a family, let's say in your master's or PhD program, it is sometimes a show of lack of commitment or seriousness. So unfortunately, if you are not careful as a trainee, you may also assume that some of those things should not be encouraged. But I think I know better now. So my real question is, how can we young trainees be more empowered to support most females, so that if, for example, you have some of these comments, you could actively advocate for the women that, it's by no fault that they are women, they also have good input, and we should really encourage them and offer support structures to really empower them so that we don't miss out on the feminine perspective and contributions that will really drive our science. Thank you.
One of the panelists.
That's a great question, Stephen.
So excited.
Go, April.
No, I just got so excited to hear him and to hear his experience. And I mean, it's corny, but I think it's beautiful, right? Like, he, was raised in one culture and saw something, was able to come to another, and we were able to give him that perspective. And those women must have been rock stars, right? Because they made him think, wow, what can I do, right? To make them feel heard, to get their perspective, to further them in whatever it is, research, medicine, education. And I thank those women, right? It's an honor and also a bit scary sometimes, because I don't want to be that woman, right? That comes into the country and people are like, whoa, that was not what we were looking for, right? And so I think it's exciting and scary at the same time to be that person. But when I first went to Malawi, my primary mentor is a female, Dr. Kate Westmoreland. She's lived in country 7 years before I ever got there. And so she was able to talk to me a bit about some things that I would face and how things would work. And still, when I arrived, like I said, I had all these projects and I was excited, but I was just struggling getting things through. And I sat down with the head of the department and Peds Hematology-Oncology there, which is a male. And I said, hey, like, these are my projects, right? Like, this is where I'm meeting like a stop. And I feel that it's due to some of the patriarchal aspects of the community, and like, what can I do? Or I've phrased it as, what can we do to fix this or to make this better? And, you know, it did help that he had 3 daughters, I think. But he was like, man, I think sometimes like I was blinded by like, I'm a male and I don't have these situations occur, right? But now that you brought him to light, like, he was very accommodating, right? And he looked at my research and he said, okay, what can we do and how can we help address this? And like I was stated earlier, for small things, right? Like, he didn't make an announcement, oh, April's a great doctor and she's got a lot of knowledge. No, it was the subtlety of when we were in rounds and there was a discussion, he would like merely look at me and say, Dr. Evans, like, what do you think? And he's like, oh, that's a great point, right? He also helped present my projects to the community. He helped present my projects to the local IRB service. And everything got so much smoother, you know, after I worked with him. And to be honest, there was like this internal conflict of like, am I giving in? Like, letting this guy help me? Which I thought, that's odd that I felt that way, right? But it was like a balance for me that I had to say, I'm here for a purpose, and that is to better care and to allow people to have a voice. How do I do that? And maybe it wasn't the initial way that I thought when I got there, that I was going to run and do and be. But by aligning with him, everything got going. And I think it was like a moment of clarity for me that this person is an ally, right? They're not a contender on who's doing the best or he has more to offer. It was, he has something different to offer. And together, like, we were unstoppable. And I think it's important to look at them as an ally. And like I said, sometimes to point out, these are the barriers that I have as a woman, and how can you help me? And you create this team-like atmosphere. Because if people go do global health, I feel we have good intention, right? Like, we're there for the patients, not for us. And so if they feel that the output will be good, they're going to help you. You might get a bad seed, but the heck with them, right? Just write them off and pick another one.
Well, I think, April, you bring up a really important point that I'd like to share, because everybody always talks about mentors and finding a mentor. And do you need a male mentor? Do you need a woman mentor? I think what you need is a mentor that actually sponsors you. It's not about mentorship, it's about sponsorship, putting you forward. So Stephen, I hope I'm answering that a little bit. So it's not just about helping people to navigate, which is really important. And I personally don't think it matters what gender, but I would ask my panelists what they think, because I'm at a different age, ancient. But basically it's about putting women forward, asking them to be on your editorial panel, saying what April said. Well, that's a really interesting point. It's really about putting folks forward. Ernesha, you wanted to say a few things.
Oh, I think it's really been captured, this whole thing. I think my mantra, and thankfully through GloCal, my whole team was a team of men mentors, Craig Cohen, Andrew Medina Morito, and Milton Weinberg. I have to give them, all due respect, because they did just that. Push me forward, bring opportunities to me, find ways to open doors. And I really think it goes back to this idea for men who are on this call and listening. What can you do? You can either be a help or you can be a hindrance. And it's like either of those things. So you think about your actions and what you're doing and how you're doing the work. Am I helping a woman or am I being a hindrance? And silence is a hindrance. And so we need you to speak up, speak out, and sometimes partner with us, but definitely push us forward. Yeah, thanks.
Ana Lucia, if you can make it short, because we have only 5 minutes left, 6 minutes left.
Absolutely sure. I'm going to try to take it to the point. I would have absolutely lacked the scientific pipeline if it wasn't because of my mentors. And I am not referring only to my official mentors, which are actually GHES either fellows or long-term mentors, which is Dr. Purnima Marivannan and Dr. Dion Stevens, or my current mentor, Nicholas Christakis. But I think the point is exactly the point that Dr. Barry just made. These were people that were invested in making me flourish as a scientist, but also as a person, as an immigrant, as a woman, as a person with a disability. So all these intersectional identities in play, and they were simply right there by my side. But I always advise younger women that work with me to get somebody outside of your atmosphere. And that I call that can be somebody that's a peer, that can be somebody that's in a higher stage of your career. So I have had, and I would say, the huge luck and opportunity of being co-mentored, not formally, but advised by people outside of my workplace that I can share, this is going on. What do you think? Has it happened to you? Because probably it has happened to them before. So I would say mentorship is not only the official mentorship, there's also this unofficial piece or this opportunity for people in different stages of career that can teach you something. That takes humility, but at the same time, it takes cold emailing people that you think will not answer your email, but that are actually invested in hearing you and giving you some piece of advice, even when you're not directly working or co-authoring papers with them. And that for me has made a huge difference. I would have left science without that.
I'm gonna go ahead, I'm sorry. Someone talking? If not, I'm gonna take the last questions because I wanna get to solutions from Naquanda Kota and Cheryl Moya, which it talks about, and Naquanda, you wanna say it very quickly about professional boundaries with male colleagues? Just really quickly. Naquanda?
Thank you. Yeah, my question is really about how do you establish the professional boundaries with colleagues that you are comfortable with, but still get the benefit of, the entire relationship and what it can do for you in terms of your career. So what are the strategies you've used to help you navigate that?
And Cheryl, do you want to add to that? I think your relentless male attention is an interesting question. Cheryl?
Yes, I have. I'm from the NPGH Consortium, and year after year, my trainees have struggled with relentless male attention and having to deal with from the time they walk out of their apartment until the time they get home at night. And even then, men knocking on the window. If you have advice for that. I think the other sub question I'll throw in there, sometimes there's this conflict between your core values and feeling like egalitarianism is a core value, and you may be in an environment where that core value feels very threatened, but as an outsider, you're not in a role to change it. So how do you deal with that? And I realize those are two extraordinarily loaded questions you could spend about an hour answering.
One of you on the panel, you want to take that so we can get to solutions?
I think that the idea that navigating relationships with my male mentors or male colleagues, it is something that I'm very intentional about. And so my offer to you would be to say, there's some things that you can trust in your gut that you can't really articulate. Trust that. In interactions where you feel like something is off, trust it, because that will help you, to know if this is a person who is meant to help you, but also in terms of you protecting your own self and guarding your own heart and guarding your own mind. Those are things that you can't give away to somebody else to do. So I don't look to my male mentors especially, they are looking after me, but I first must look after myself. And so I would encourage you to do the same. The second question, I'll turn over to my co-panelists.
Anybody want to take the second question very quickly?
Real fast, was the question just to do to like the female male, like an uncomfortable, like if they were to take it past a professional barrier, or was it more?
Yes.
Okay. So I like to think myself as young, even though I'm mid-30s now, but it's actually something that I'm always conscious about. And I do little things to try to make sure that that relationship stays very professional, and that it's harder for them to cross a border, okay, or a line is how I put it. It goes from what I wear when I go to meet them. I make sure that, and it's goofy things, but I make sure that I'm dressed very professionally. I make sure that the agenda that's discussed is only about work, and I don't bring in outside conversation at all. I always meet in either a public place or the office. And in my experience, I think meeting like that and only discussing things in a professional manner have really increase that threshold. Like, I think that someone would have to be very bold to step over it. It doesn't mean it doesn't get overstepped, but I think by just setting yourself up safely, like dressing professionally, talking professionally, only meeting in public or at work, workplace settings, that's helped manage that that professional barrier. But it does get crossed, unfortunately. And when it does, you make sure that you have somebody to talk to. And if you don't feel empowered, then try to reach out. But yeah, it's definitely something that you do have to balance. And I'm hopeful that in the future, maybe those things are less common.
I'm going to stop here because we're finished, and I'm actually moderating the next panel. So I'm going to give us a few minutes to just talk about some of the solutions. And I know we as panelists talked about this, and Ana Lucia, I'm going to ask you to talk about one other solution that you had, where I asked what steps the medical profession establishment can foster, how they can foster more women in science and medicine. You want to answer that before I get to the larger solutions?
Of course. Well, as I have mentioned a few times already, I believe there's multiple levels. The first one is this one. I think this conversation itself, where everybody is attending, and I'm going to do a small parenthesis. When I had this panel and I was a fellow, it was only women attending. So I was surprised that this was now a conversation for everybody. We're already striving, and I think we're already having something put on the table at the cultural level by having these types of panels. But I also think there's also specific things that need to be done. This is not enough. It is not only about talking, discussing, like sharing with each other, mentoring. We need to have issues sort of like considering having a budget differential for women going into the field, depending on the type of context she's going into. One of my co-panelists was mentioning dressing in some way, going into some places, but can we consider that transportation might look different? So for instance, I had to use a car instead of a motorcycle, a different type of car, or maybe we actually budget for this type of community protection that people give us when we're in the field? Or can we actually consider specific pragmatical solutions that we can talk through openly throughout our projects? So I think there's multiple levels, and the one-on-one is one of them. The cultural piece is the other one, but the practical piece of getting this into solutions in our projects while we are on the field, and that we're able to raise these questions or raise the hand and say, I am in India, I am in South Africa, I am in Latin America, and therefore these are ABC needs that women need to abide to, because we need to sort of like get some differential support in order to carry on type of research that wouldn't be a barrier for a male scientist or a male identifying person. So that would, for me, travels into security, and one of the things that Dr. Barry is about to discuss in a more informed way than I could ever do.
I'm just going to briefly, because we're really late, but I wanted to give some solutions, potential solutions for challenges climbing up the institutional ladder. I have them here: mentorship and sponsorship, leadership grants, which is what Ana Lucia was talking about, but particularly also for resource-poor countries for women. I'll talk to you a second about women lift health and engaging male allies. The career family, we need to have time extensions to accommodate maternity leave, child rearing, elder care, subsidized child care. And I think we've talked about how to strategically manage and mitigate risk. A lot of that is on us, but there could be supplemental health insurance, travel medications, and sexual harassment. So lastly, a call to action is to cultivate thought leadership around gender. And I'm so happy NIH is doing this panel. Think of ways to lift women up the ladder, advocate for women work-life integration, not balance, but integration of family and career. eliminate the pay gap, which is still there, increase, even at Stanford, even at my level, increase visibility of women, address the leadership gap, and then ask for your institution to have accountability and a process to address some of these inequities. And lastly, I wanted to talk a second about Women Lift Health, because all the women are eligible for this. And this is a one-year leadership training program that is Gates funded. It's a fabulous program where you get a mentor, you get the curriculum, you're in a cohort, you get a coach, a personal coach, and it is a great, I think, a great leadership training. It is spun off as an NGO. So we're going to end now. I'm sorry this became a little bit rushed at the end because we clearly needed more time for this. And I'm going to start moderating the next panel, which is, and I want to thank the panelists. These are dynamite women, rock stars, and I really appreciate this conversation. So thank you very much. I guess I have to escape this.
Thank you so much, Dr. Barry. We have a short break and our next two sessions begin at 1:55. I just want to give a little bit of instructions about those two sessions. If you are interested in the NIDDK session with Dr. Germino, that's the National Institute of Diabetes and Digestive and Kidney Diseases, that session will remain in this room. So after your break, you just return to this Zoom session. However, if you would like to attend the NINDS session with Dr. Benson, Kristen is going to drop another link in the chat, and that you will take that link to join for the NINDS session. After those two sessions for this afternoon, we will be finished for today. So after those sessions end, you can just log off, and then we'll have another link for tomorrow. You should use your at-a-glance agenda to navigate for tomorrow. Are there any questions?
I also have no problem staying a little bit to 10:55. If people want to ask some, we have so many questions. Would that be okay?
Sure, that's fine. So again, if you're staying for NIDDK, you stay in this room. If you want to just stay and ask Dr. Barry questions or listen to that, that's fine. But the NINDS session is starting at 1:55. Thank you. Thanks again, Dr. Barry.
Thank you. Joselito, if you're still there, could you ask your question? And I think it was a question that I was about to ask, which I didn't get to. Joselito, are you still there? If not, I can ask the question.
Hi.
Hi.
Thank you for this conversation. I think that you touch a very important issue that many societies live today, and it's a reality not only in my country but in many countries around. So I encourage also the development in science of women, because there are many changes that has to be done. And my question specifically, it was about, could you suggest some short-term or medium-term actions that we can take to strengthen the skills and promote gender equality in science?
And I guess to also further that is, what steps can the medical establishment take to foster more women in science? Which of the panelists would like to take that? These are Joselitas. Are my panelists there?
Yeah, I can go. I said some of them, but I would say because right now the medical establishment is by statistical means mostly men allyship is one key piece of it. Putting this on the agenda, putting budgets on it, allowing the possibility of understanding that the category women itself, it's not enough. There's intersectionality in this. I have seen a lot in the chat, a lot of discussions about I'm a mom or I'm not a mom. I take care of my parents. We do a lot of care jobs, but we also have other types of identities. So I would say, like, putting in the table that it's also at the level of policy that we should also admit that we could be going into a different direction if we consider women as a unique or overarching category, cross-culturally speaking. I would say the medical establishment can do some policies in terms of cultural change, but as I said, this is a multi-leveled action. We also need to have these one-on-one conversations. We also need to have these mentorship conversations. This might look different in different parts of the world. So my advice would be carry in your bag intellectual and cultural humility to understand what gender means in your country of destination. Because those policies that might work to foster women here in the United States might not be the same ones. We might be in a different situation and need different strategies and adapt quickly to them in order to foster our RAs on the field, or our supporters in the field, or our community in the field. So I think there is no one single answer. That would be my answer. This is too complex to sort of like say, this is what we should do. Short term, as I said, considering security issues and all the problems that had already, I'm not going to repeat them. Dr. Barry has already done an amazing job describing the problems and the main issues and possible solutions.
I want to push you guys a little bit further, and I know some of you have children, but in the chat, there's a lot of how we can talk about the barriers to women with children who work in global health and science. I'd like to spread that out to our male allies. I'd like to be an ally to the men on this call, because many of them are also parents. So would one of you want to take a stab at what are some of those barriers? Personally, I always brought my children overseas. And personally, I think it's much easier to have children overseas because help is much more economically accessible. But maybe one of the panelists would like to give their particular feeling about barriers to children and global health.
It's one of the panelists or one of the men who are going to talk about how they also share in this labor, because I do feel like, I don't know if you guys saw, my daughter just sort of hopped up in my lap for a second. And I think it is I like that it's not about balance, but it's about integration in terms of how we integrate our lives as moms or caretakers in any form in our scientific pursuits. And how do we do that I think that there's space for that. And I think you listed it in one of the solution slide. I also think that men get to feel bad about missing something with the children, and then it's excused. But moms really kind of hold the weight if something goes wrong. And I think that that's a societal shift. I think it's a societal shift that looks at, me wanting to be, a top scientist and do, advance my career and judge me based on my motherhood. That's a societal issue that I'm not really here to solve because I got to keep going. But that is something that I think for the generations to come, that they are probably going to have it better. And I know every round goes higher. And so I just, think if the men sort of think about what it takes to actually do the caretaking and pursue a career, and then, have some grace and make space for that. I think that that's, for me, a way forward.
Do any of the males on the call, we really haven't reached out. Anybody want to add your feelings about that? I'll give you a few seconds to be brave enough to talk. Any of the men want to talk about the burdens they have raising children in global health?
I can do it as one of the old people. I forget what we're called, the ancients. But I really, I get great joy out of my family. So I know not everybody wants to have kids, but my wife and I brought our son along to Peru when we lived there initially. And it is, I think, one way we can address this is living by example. And I love the idea of using the word integration rather than balance. But for me, I wanted to be there for all of my kids' events, so I did it. And I think as other men see people go and do things like that, they'll realize that there are things they could have been missing out on. I think there's great joy in having your family. And I made sure that I wouldn't attend any meetings where I would miss something important in my kid's life, whether it was in a play or singing a song in a strange little kindergarten group. But I think it's just where you put your priorities. So I really value family, and hopefully my example of making time for family served to change somebody's intentions, but I'll stop there.
Thank you. Thank you, Joe. I'm going to end this just to give us a break, because I see some of our folks on the call have come in for the next session. There is one quote I wanted to, somebody said a wonderful thing in the chat that I wanted to quote about silence and silence being a hindrance. Does that person want to? I'm trying to find it again, but I do think you cannot be silent about this issue, that we're all here as a group to support each other. I think Fogarty is a wonderful home because I do think Roger and Peter and all the folks and Andrew are very supportive of both women and men raising families in global health. So I would be, I'm going to end with silence is a hindrance. We need to have these discussions. I'm sorry we didn't have more time. I'm glad we went over a little bit. And Ana Lucia